Good morning everybody. I am Dr. Krishna Kiran. I am a surgical oncologist working at American Oncology Institute, Nalagandla, Hyderabad. So in this video, let us discuss about the common symptoms of colorectal cancer so that the disease can be diagnosed early and treated effectively. Colorectal cancer is a very common cancer globally. In fact, in men it is cancer, and in women it is considered to be the second most common cancer, and the incidence is increasing worldwide. So coming to the symptoms, most of the colorectal cancers in the initial stages do not have any symptoms, and that is why by the time they are diagnosed it is usually at an advanced stage. In order to mitigate this problem, colorectal cancer screening has come into effect decades ago in the Western world, and today, considering the fact that in India also colorectal cancer rates are increasing, we need to have an awareness about this cancer and how to diagnose it early. So the common symptoms of colorectal cancer are bleeding per rectum, that is the most common complaint which the patients present with. The other is an altered bowel habit, that is there is a change in the regular bowel habit. The number of stools that the person passes per day may be increased, or patients may present with constipation. The other symptom in rectal cancer is called tenesmus, which means in a painful defecation and a feeling of not being able to empty the stool entirely. In later stages, patients may complain of abdominal distension and also obstruction to the passage of stool. Depending on the site of cancer, especially in men, anemia is a common phenomenon. In fact, any male patient presenting with a low hemoglobin, first we should rule out colorectal cancer, because the causes of anemia in men are very few. In women also, we have to be really vigilant about this malignancy, because in early stages it is considered to be curable. So coming to colorectal cancer screening, so screening is done when a patient or when an individual has no symptoms at all. So in the Western world, screening usually starts at the age of 45 years, and it is high time that we in India also start adopting screening practices on a regular basis so that these cancers can be detected early. So there are a few screening tests available, all of which are safe and easy to perform. The safest way and the cost effective way is to perform a stool test to detect blood in the stool. So in this, a fecal occult blood test is done. That means a sample of feces is taken to check whether there is any bleeding in the stool or not. And in order to increase the sensitivity of this test, second generation tests have come up which detect minute quantities of hemoglobin in the stool. These are known as the stool DNA test or the fecal immunochemical tests. These are very safe to perform, and home kits are also available where the person can detect do the test at home itself. So coming to the other test which is considered the gold standard, it is colonoscopy. That is, a tube is passed into the large intestine per rectally and the whole of the colon is visualized, and this is the best test to detect colorectal polyps. And when this test is performed and it is found to be negative, then we can rest assured that the person is not suffering from colorectal cancer. This test is performed by a doctor in a outpatient setting or sometimes in a hospital setting. In the next video, I will be discussing about what are the tests that are to be performed to diagnose colorectal cancer and what are the treatment options available for this disease. Thank you.